the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today in the show, we have Albert Al-Hatem. He's a pathology resident, and he co-wrote the Kevin MD article, Is Pathology an ATM Machine? Albert, welcome to the show.
Thank you. Pleasure to be with you.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yes, so I'm originally from Syria. I finished medical school in Aleppo University and then escaped the war to the US with the hope to become a doctor here. When I first arrived, I didn't know how to speak English or didn't have any resources. I struggled a lot at the beginning, but slowly, I taught myself English and medical research. Then I was fortunate to get accepted into the postdoctoral program at Harvard Medical School, where I finished graduate school and postdoctoral fellowship, and then followed by another fellowship from Stanford Medical School. And then I was accepted into Rutgers University, where I'm currently finishing my residency in pathology. And soon I will start my fellowship in dermatopathology at St. Louis University.
So I don't have very many pathology residents on my show. So describe to my audience what your pathology training looks like.
So pathology is like radiology. It's a diagnostic field. And we have two branches, anatomic and clinical. And pathology in many programs are 4 years training. If you choose to become just anatomic or clinical pathology, you do just 3 years of training. And you work basically in a lab where you receive a specimen to diagnose them, to give patients diagnosis whether this is a cancer or not. We are called as doctors of doctors because we deal with doctors all the time. So our job as a pathologist is a consultant to surgeons or medical physicians who basically operate on patients in order to diagnose basically disease.
And while you were in medical school, what was the general interest level in pursuing pathology for residency?
Me personally, I was very interested when I was studying medicine. In third year, I had a chance to work with the pathology resident, and combined with my passion for painting and art, I thought pathology would be a great fit for me because you get to see pictures all day long. It's very colorful. Also, like you get to think a lot about like your diagnosis. So I rotated in the lab, and I basically was spending most of my time with the pathology team, and I became very passionate about this field. And so when I got a chance to choose to pursue residency, it was no question, it was pathology for sure for me. However, I noticed like here in the US and also like other parts of the world, pathology is not very popular because in medicine, they don't focus on pathology while you are doing medical school. And that's why like probably most medical students, they don't think about it much.
So let's talk about the Kevin MD article that you co-wrote. It's titled, Is Pathology an ATM Machine? Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to co-write it?
Sure. So the article is based on a real life story. I was working late in the hospital Friday night, and as I was ready to leave the hospital, a nurse showed up with a specimen for an intraoperative consultation for a liver transplant. The surgical team flew all the way from a different state to procure the liver to a patient. After my attending and I gave the surgeon the good news that the liver could be transplanted, I didn't expect that anything will happen afterwards. But a few months later, the same surgeon came to our hospital with his patient to thank us. He had traveled a long distance to meet who had made the decision that night that saved his life. I was honestly humbled and impressed and overwhelmed by his attitude, because not many people appreciate or know what pathologists do. Some clinicians view pathology as ATM. You put something in and something spits out. But the more enlightened clinicians view pathologists as consultants and partners. So that's why I think I thought like to write the article with Dr. Deborah Heller to give your readers some perspective, because I thought this is very important issue to highlight.
You have a platform here. Tell my audience, what are some things about pathology that you want other clinicians to know?
For a start, I would say what I wrote in the article, that pathology is not like black and white. Most clinicians think of pathology is like they give you some specimen, and based on the specimen, you will give them like short, concrete diagnosis that they can understand. However, sometimes the specimen, especially nowadays with the minimal invasive surgery, the specimen is fragmented and small, and you cannot tell whether this is like black or white. Sometimes the diagnosis is in the middle, in the gray zone area, and you try to communicate with your clinician about your diagnosis. The other thing is communication. Like most clinicians, and thankfully here in our place, they come to our lab and they look, some clinicians, they sit with us under the microscope and they look into the specimen. So when they explain it to the patient, they have some deeper idea about the meaning of the diagnosis. Pathology is, I think, the basis of medicine, and not just this is my own view. If you read the medical history, most of the big discoveries have been made based on pathology knowledge or based on anatomy knowledge. And unfortunately, nowadays, because of the medical technology, we forget a lot about these basics. And even like nowadays, with all the advances in technology we see in medicine, pathology has contributed a lot into the field of medicine. So I think because of like your platform has a lot of readers and viewers, I thought to send the article to this platform, because I knew that it will make an impact on non-pathologists as well as pathology clinicians.
Now, what would you say are some of the biggest challenges facing the field of pathology today?
One of the biggest challenge is people are not interested in the field, starting from medical school. Every year, if you look, for example, into the NRMP data, the matching data, every year there are some spots unfilled in pathology. Even if you look, for example, now, if you go to a website like Pathology Outline and you look into the fellowship, there are a lot of openings, a lot of unexpected openings, a lot of new openings. Even if you look into jobs, for example, there are a lot of jobs for pathologists. The reason is because I think most medical students and doctors, they don't desire to go and work as pathologists. I think that's the most challenging in terms of like our field, is the shortage of pathologists in the future. And as you know, most clinicians retire at certain age. So at some point, all the people now working in the field, they will retire, and so it will create like a gap if we don't have supply of new generation. So I encourage everybody listening to this platform to consider pathology. You don't have to choose, but at least explore pathology. If you are a medical student or if you are a resident in other field, explore pathology, learn about pathology, visit the lab, interact with your pathologist, and know more about like what they do. Maybe this will inspire you to become pathologist, or at least to become a better physician, even if you didn't become a pathologist.
So walk me through a typical day of a general pathologist.
The day for somebody who is in training is different from the day who is somebody who is like, for example, early career or, for example, later career. But most of them, they share the same kind of like goal, that every day they come with in mind that they want to make diagnosis. So it's a diagnostic field. So you will be presented with certain number of cases, and you have to review the history by looking into the medical record. And then we use, as you see in my back, we use the microscope to make the diagnosis. So some of us, like, they see between like 10 to 20 cases a day. Some of us, they see 100 cases a day. Depends on the volume of the place you're working in, and depends on the specialty. Some cases are easy, some cases require extra staining or extra tests like molecular testing, or extra, for example, special staining. So the case may go like for some more days until we receive those extra tests, and we put everything together along with the clinical information to make the diagnosis. And in academia is a little bit different, because you have the teaching component. Mm-hmm. So you interact with medical student, with resident. So your day includes also like teaching. And also like you may be interested in research or interested in writing. So you end up like, for example, most of my papers who I published during the past 2 years came from real patients. Like I was looking into a case, and this case was challenging or was rare. And the case proposed an idea for me that became a project. And then I collaborated with some of my attending, some of the medical students that I worked with here in the university. And then we worked on this research project. So your day becomes like not just clinical practice or taking care of patients, but you teach, you also do research. Mm-hmm. If you are in private practice, is totally different, because you will be just like sitting in your office. And most of pathologists work in a group, so you will work with other pathologists in the same office, and you will be like diagnosing, looking into the microscope, looking into the patient history, reviewing the radiology, or maybe calling the clinician to discuss with them, and then looking under microscope to look for these specific, for example, histologic changes that mm-hmm. you might favor in terms of this diagnosis or that diagnosis, and then writing your report.
We're talking to Albert Al-Hatem. He is a pathology resident, and he co-wrote the Kevin MD article, Is Pathology an ATM Machine? Albert, if I'm a medical student looking for a potential field, what are some characteristics that would best suit me to become a pathologist?
I would say first, like, you have to like to look into images. So if you are a visual person, like to see things, I think pathology would be a good fit for you. Second, pathology is analytical field. I think medicine in general is analytical, but pathology takes the analysis into like more deeper level, because as like one of my teachers used to say, they give you the window and they ask you, where is this building located? So you have to have like some sort of like three-dimensional analytical mind in order to like pathology. A third, I would say, is the real test would be like to go and rotate in a pathology lab, mm-hmm. interact with pathology residents. Would be like better if you rotate in a residency program, that you see the residents, you see like the attending, you interact with them. And then is like basic just attitude, like for surgery. How do you know you like surgery? You go and you rotate in a surgery department, and you feel like, oh, I'm part of the club now. Everybody know me, and everybody basically interacts with me. And I like to sit in an operation room, manually operating on a patient who is asleep. So like the same things you can apply for pathology. Some people think that we sit all day long under the microscope just looking into slides, which is not true, because like we have to have like a certain criteria or characteristic to be able to communicate with physicians, to be able to talk to physicians, to be able to explain our diagnosis to physicians. So we're not like a bunch of weird people sitting in a room all day looking into our microscope. We are very social, very active. We like to interact with people. We like to study diseases as matter of fact, but also we have like basic human characteristics. So if you are a medical student listening to this conversation, I encourage you first to visit the pathology lab, rotate there for a couple of weeks and interact with people. And then after you see for yourself, see if you like to study disease, because pathology, from my own experience, it gives you like deeper understanding about medicine and gives you like an opportunity to do research on deeper level, more than just like the clinical aspect of the disease, but understanding the mechanism, understanding the treatment, how the treatment affects the tissue, the cells, and how we make difference in the body. Is very, very interesting field.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Maybe it's like not related to pathology, but I like to say something from my own life experience, because when I came here to US, I had many difficulties in terms of like achieving my dream to become a doctor. And I would like to use your platform as to send message of encouragement to all those who maybe in unfortunate circumstances, to consider that life is meaningful and don't lose hope. Van Gogh has painted 1,700 portraits, but sold only one piece for $85 in his life. And nowadays his work is worth millions of dollars. He unfortunately was victim of depression because people did not believe in his work, and consequently he lost hope. Social media unfortunately has led people to work towards pleasing others rather than focusing on becoming the best version of themselves. If only we realize the good that we are doing while doing it and how our work will impact the lives of people we serve, we too wouldn't lose hope. So I would like to thank your audience for listening to this conversation. And I encourage you to, if you are listening to our conversation, to consider pathology for your plans.
Well said. Well, thank you so much for your time and insight. And thanks again for being on the show.
My pleasure.